What is drug testing for welfare benefits? Have you ever wondered how drug testing for welfare benefits works and why it matters? This policy requires individuals applying for or receiving government assistance to undergo drug tests. The goal is to ensure that public funds are not used to support illegal drug use and to encourage a drug-free lifestyle among recipients. In the United States, various states have implemented or proposed this policy, especially since the late 2000s. States like Florida and Michigan have passed laws that requiring drug testing as a condition for eligibility or continued receipt of benefits. Programs affected often include temporary assistance for needy families and other public assistance programs. From a libertarian viewpoint, drug testing for welfare benefits raises several important issues. First, individual liberty and privacy are core values in libertarianism. Mandatory drug testing can be seen as an invasion of privacy and government overreach. Many argue that such policies intrude into personal lives without just cause. Next, there is the question of the government's role and responsibility. Libertarians believe that government assistance should be minimal. They argue that individuals should take responsibility for their own choices. Drug testing can appear paternalistic, suggesting that the government must regulate the behavior of welfare recipients. This conflicts with the libertarian principle of personal responsibility. Another consideration is the effectiveness and fairness of drug testing. Evidence shows that testing welfare recipients can be costly and often yields low rates of positive drug tests. This raises concerns about fairness, as these policies may disproportionately affect certain populations. Libertarians advocate for policies that are efficient and just, avoiding unnecessary burdens on individuals. Consent is also a significant topic in this discussion. Some argue that since welfare is government aid, recipients implicitly consent to conditions like drug testing. However, libertarians counter that conditioning aid on drug tests forces individuals into compliance with invasive procedures, undermining the idea of voluntary participation. Lastly, libertarians often suggest alternatives to government welfare programs. They may advocate for reducing or eliminating these programs altogether, favoring private charity and voluntary support instead of government mandates like drug testing. In summary, drug testing for welfare benefits is a policy aimed at ensuring recipients do not use illegal drugs. While it is often justified by concerns about misuse of public funds, libertarians argue that such policies conflict with individual freedom, privacy, and limited government intervention. They view these policies as potentially unjust and inefficient, raising questions about the appropriate role of government in regulating personal behavior among welfare recipients.